Hello, Professor Bornstein. Thank you very much for your presence in these important scientific events in the last couple of days in Romania. The 12th European Teaching Course on Neurorehabilitation, which we had in Eforie, and now here in Cluj, the Symposium on Cerebrovascular Disease, a Multidisciplinary Approach. From your point of view, how relevant and useful is this multidisciplinary approach in the field of cerebrovascular diseases?
Thank you very much for the question. I think, first of all, the Eforie event for multidisciplinary approach of neurorehabilitation and this event are very important, and the Eforie event was very successful in terms of integrating this interdisciplinary approach. I believe in team approach. To integrate all the pieces together and the different disciplines in order to achieve the maximum beneficial effect for our patients. Each one of us has his own specialties and knowledge how to do things, but we have to put all this together to have a full puzzle and the metrics in order, and the knowledge of each one of this part. Like if you look at for instance, in my field of stroke, you need to have the pre-hospital ambulances expertise. You have to have the emergency room physicians and nurses. They have their own expertise how to deal with this emergency situation. Then you have the stroke unit. Within the stroke unit, you have the stroke neurologist, but you have also physiotherapists, speech therapists, and occupational therapists. All these together are needed in order to have an approach as a whole to the patient. And I think that this approach of multidisciplinary approach is the way to go, and this is very important to implement this approach in every single part of our work.
As the world enters the third year of COVID pandemic, would you be so kind to elaborate more on some of the less discussed aspects of the COVID impact on stroke patients?
Thank you again for the question. I think that first of all, we know that COVID affected many people. And even not in the mild form, we know nowadays what we call long COVID. And these are very important aspects that we should pay attention to it. And in many places, at least in my place in Israel, many post-COVID and long COVID outpatient clinics were open and to address the various aspects and the various complaints of the patient. With regard to stroke is a very interesting effect. At the beginning, people were afraid to come to the hospital because of the COVID, so there were observation of less stroke or reduction of stroke, inpatient stroke, that arrived to the hospital. Nowadays it's back to normal, but as we all know, the virus has effect on the endothelial cells, which is and they have a thrombogenic effect, means that they can cause clots in the arteries and block the arteries, mainly in the lungs, but also in the brain. So we think that there has been effect on stroke. There's some reports on young stroke patients with large vessel occlusions that's without any other risk factors of stroke. So definitely there is effect of COVID on stroke, But I think it's more on the small vessel disease that are still unknown, because some of the small vessel thrombosis, infarcts, are going unnoticed, what we call silent brain infarction. So we will have to observe all these patients that were affected by COVID and look in the long term whether they were affected by these small vessels occlusions, infarcts in the brain. But otherwise, in general, we think that there was not a very significant effect on COVID on the vascular events in the brain. We could not observe a significant increase of strokes, but in some instances, the type of stroke was changed. We have to look at it, and time will tell.
Thank you. One last question for today. What are, in your opinion, the future challenges in the management and treatment of stroke?
As we all know, in the last 2 decades or more, the acute stroke treatment has gone a very long way, and nowadays we have an advanced therapy for acute ischemic stroke with either IV TPA, thrombolysis, or with thrombectomy, that we take the clot out of the brain. The challenge in this particular part of stroke is to extend the number of patients that are eligible to have these therapies. Like nowadays, we know that thrombectomy in selected subgroup of patients we can implement in up to 24 hours. Maybe we should extend it. Maybe we find new thrombolytic agents, like we have alteplase, TPA. Now we know that there is tenecteplase, TNK, which is more easy to use because we have to give one shot. It's much cheaper, and maybe this will be more extended as a treatment instead of TPA. Maybe you find some other solution. And I think that the challenge is, first of all, to educate more and more and more the people about time is brain and about stroke symptoms in order to arrive in the hospital in time to get the treatment. Most of the cases, they cannot or would not get these therapies. They are life-saving therapies, and saving disability is because people do not aware of stroke symptoms and are not coming in time to the hospital. Another major challenge is something which for decades was neglected, and we still don't have an approved treatment, is the intracerebral hemorrhage. Intracerebral hemorrhage is one category of stroke and affecting about 15–20% in this part of the world, but much more in the Asian and the East part of the world. And as we all know, 2/3 of the world live in these places. And they have much more intracerebral hemorrhage. Still, we don't know how to treat these patients. So there is a lot of effort nowadays to find solution, therapies with different agents, either to block the expansion of the hemorrhage or to evacuate the hemorrhage, the hematoma, by endovascular or minimal invasive surgery, etc. So I think the challenge is for us as a stroke neurologist is to educate the patient, first of all, for prevention, of course, to make sure that people are aware of all the risk factors, to control the risk factors, and the lifestyle to have a Mediterranean diet, to do exercise, and to watch their weight. And the other point is therapies to educate them about stroke symptoms, awareness of symptoms, and to come very fast to the hospitals. And the best way to come to the hospital is by ambulance. Third is to tackle the question of hemorrhage. And of course, we have a lot of work to do with the low middle-income countries that they have no accessibility to all these advanced therapies, and we have to implement more stroke units all over the world and to reduce the burden of stroke as a killer, as the major disabled factor. So these are the challenges for the next decades as far as I can see it.
Thank you so much for your very comprehensive answer and presentation on this
Thank you very much for having me, and I think that we should continue to deal with multidisciplinary approach and to tackle the stroke burden around the world.
Thank you.